I hope you've had a really good day. So today I'm going to talk for the next half an hour or so about perimenopause and menopause beyond HRT. So whether we take HRT or not, we still have to look after our future health. And there are many people out there who think that HRT is going to do everything for us, or think that if they don't take HRT they're missing out. So I just thought I'd do something that was really inclusive for everybody, because much of my work is trying to reach as many people as possible. As I'm sure you know, 51% of the population are women. Therefore, menopause affects 51% of the population directly, but 49% indirectly, because obviously all men know women. And menopause is something that's guaranteed. We're not all going to have a certain lifestyle, we're all not going to get married, we're not all going to have children, we're not all going to have certain jobs, but we will become menopausal. And as many of you know, the menopause is more than a period stopping. Without our hormones, which are biologically active, that work all throughout our body, there are health risks associated with them, with the menopause. And those health risks are there, and they're higher the longer a woman is without her hormones. And so for this Instagram Live, I think it's really important to focus on those health risks. We know also that there are a number of symptoms that occur when people are perimenopausal or menopausal. There are dozens and dozens of symptoms, and not everyone gets symptoms, not everyone gets all the symptoms. Some people hardly get any or not at all, some people get loads, or symptoms can vary. So for example, some people start off having some flushes and sweats, and then they might develop some anxiety, low mood, memory problems, and then they might develop some urinary symptoms like cystitis or recurrent urinary tract infections, or they might all happen together. So we're all individual, and obviously our experience is going to be very individual. And we know obviously that because the symptoms are related to low or changing hormones, the first line evidence-based treatment for symptoms is actually to replace the missing hormones. But I want to think beyond that. I want to think about what's happening to our bodies when we're menopausal and this increased risk of diseases. And actually the diseases that increase when we're menopausal are all the inflammatory diseases which increase as we get older. So when we have increased all the commoner diseases, so these include heart disease, osteoporosis, diabetes, cancers, dementia, and actually an earlier death as well. So we know that it's great, isn't it? Women are living longer than ever before. In the Victorian times, the average length of time a woman lived for was 59. And actually, interestingly, the average age of the menopause was a bit older. It was more like 57. So in the Victorian times, women on average would only live a couple of years being menopausal. Now we live a lot longer being menopausal. Many women live decades, so 3, 4, 5, even 6, 7 decades if people have an earlier menopause. Great people are living longer, but actually are they healthy? Not always, and there are lots of reasons why people have an increased risk of diseases, and actually their future health is not as good as it used to be. But a lot of it is due to this inflammation that can occur with low hormone levels, and also lifestyle as well. So when we're looking at how to look at and manage the menopause and perimenopause beyond hormones, we need to think about what can we do to really improve our future health. Many of you know that I'm a physician that's very interested in preventing disease, but actually preventing disease without medication is really important, because there's a myriad of medications that can lower blood pressure, reduce cholesterol, even reduce weight, help us sleep, reduce pain. All these things can be medicated, but isn't it better if we can try and prevent and do a lot ourselves? So one of the most important things, as I'm sure you know, is something else that we all have to do, which is eat. And we can choose what we eat. And this is crucially important, because what we put in our mouth determines often how healthy we are. And often it can be very difficult to get a really healthy, balanced diet. And in fact, earlier my oldest daughter Jess was talking to me that she'd watched a programme, and she was shocked about the food that was available for people who worked in hospitals. And it's absolutely right. Sometimes it's really hard. I know when I was on call as a junior doctor, I only had access to vending machines. Now, you can't get anything fresh and healthy in a vending machine. Many of us have to be really organised when we're thinking about our work and our if we're away for the day. And quite often I go down to London for meetings or various things, and I'm always having to take food with me because it's not so easy to just nip into a greengrocer's and buy some fresh fruit or vegetables or buy something that isn't processed. And so I actually make a lot in advance. So I often have big bowls of salads that I've made with fresh vegetables, with olive oil, with herbs, with spices, usually roasted vegetables in them as well, maybe some cheese that I've cut up and plonked in, anything that's going to help give me a balanced diet, feed my microbe, but also then I just decant it into a empty yogurt pot. So then I take it with me on the train or when I'm away or out for the day, and then I can just put the yogurt pot in for recycling. I don't have to carry it back with me. And it's just quite a good hack. But looking at what we eat is really important, and I have done an Instagram live about nutrition. But we should be thinking about what we can add into our diet that's really healthy. So rather than just withdrawing and reducing the amount we eat, we should be adding things. So we should be looking at fresh vegetables, fresh fruit. We should be looking at seeds. We should be looking at herbs. We should be really looking at this biodiversity to really feed our gut microbe to make it healthy and happy, because actually our gut microbes can determine our metabolism. They can determine our health, our brain health as well. Actually can help our mood, but also it can help reduce inflammation as well. And there's increasingly more and more studies showing that actually inflammatory food or foods that increase inflammation especially are the processed foods. So we should really be limiting or avoiding processed foods, and also it's not just what we eat, it's drinking as well. So try to avoid sugary drinks. Even juice is not great, and certainly fizzy drinks are something that we should be avoiding as well. Alcohol we should be limiting. I'm not saying that you can't have alcohol, but we need to be limiting as well. But what we want to do with food is have lifelong changes. So not just thinking, oh, I'm going to cut out something or I'm going to change my diet for a short period of time. We should enjoy what we eat, and it should be a pleasure. And I love actually creating really healthy food, and I love giving it to other people as well. So the more that we experiment with recipes where we feel that we enjoy it, it's tasty, it's nutritious and keeps us full for longer is really important. So looking at little simple recipes, or even, for example, if you're making bolognese, if you eat meat for your family or children, just add in some lentils or some chopped vegetables, because it will make the meat last a little bit longer, so it make it a bit more cost effective. But also it's got other nutrients that's going in as well. So trying to really be honest with yourself and for your family as well. So a lot of these things I'm saying are not because it's menopause or perimenopause, it's more for future health. So we know that eating a diet that is going to reduce inflammation is really important, and important for our brain as well. Some of you might have read or are going to read Lisa Mosconi's book, and she talks a lot in her new book, but also her previous book, The XX Brain, about foods that help reduce inflammation in our brain. Really, really important when we're thinking about our whole body. So when we eat, we're not just eating to fill our rumbling stomach. Actually, all these nutrients go into our bloodstream, go around our body, and can really help feed everything and make a huge difference to our organs, which we want to keep as healthy as possible. So nutrition is really important. The other thing that's also really important is our sleep. Now, I was a bit thrown out last night because the clocks changed, didn't they? So I got up early, as I always do, was working, and then I looked at my computer and thought, gosh, that time's gone really quickly, and I forgot that actually it was an hour later. But actually I had the same amount of time in bed, so it was all right because my alarm clock next to my bed didn't change time. But we need to think about our sleep, and I've mentioned sleep before, and it can be one of the first symptoms that can really occur and be quite long lasting actually for a lot of women when they're perimenopausal or menopausal. And I know myself, when I was perimenopausal, I used to be really tired and have to go to bed quite early. And then once I got into bed, even though I felt exhausted, It took me a long time to get to sleep. And then I'd be wide awake at 3, 4 in the morning. And that's when my mind would start to race, and I would think, and I would worry, and I would ruminate, and I would obsess. And I'd have a pen next to my bed, and I would write down lists of things, but I still couldn't switch my brain off. I still found it very difficult to get back to sleep. Lots of people experience that similar with sleep. So although we know how sleep hygiene, if you like, is really important, most of us know how we should avoid our phones by our bed, we should avoid blue screens, so ideally not watch television in our bedroom, we should dim the lights, we should have a bath, we should use lavender spray on our pillow, we should avoid caffeine in the afternoon and evening, we actually should avoid alcohol as well later, because that can really affect our sleep cycle. But even all those things, it can be quite difficult to get good quality sleep. And one of the things I'm quite good at is meditating. And there are different ways of meditating. But actually the ability to clear your mind is really important, because once you start to worry that you're not asleep and worried that you're going to be more tired tomorrow, it can actually compound how you're feeling and be very negative for your sleep. So thinking about whether you can meditate, focus on your breathing as well, which is something that we can control. Most of the time we don't think about our breathing, but actually really focusing on our breathing, slowing it down, will stimulate our parasympathetic system and our vagus nerve, which is actually very calming in the body. There's this thing called alternate nostril breathing, which some people might have heard of, which again can be really good. And it's ways of just calming everything down in the body. Just knowing that we can relax, even if we're not sleeping, we need to relax our whole body, including our brain as well. So that can be really useful. There are different apps that people can use to meditate. There are books, just talking to different people, but having a technique that works for you. And it might be not 3 in the morning that you need it. It might be before an important meeting, or it might be in the middle of the day when everything's getting too much. And trying to simplify your brain, I think, is a tool that I learned a few years ago, which can be really useful. Focus on the here and now, and looking at mindfulness is really important. Even little things like focusing on the smell of the soap that you're using or the shower gel in the shower, just enjoying the moment, looking out the window and reflecting on what season it is, whether you can see any blossom, or even if you're hearing the traffic, just try and think about what you're doing. And then when you're focusing on a task, try and think just on that task, because it can be so easy to be distracted by noise, thinking, oh, I wonder if I've got an email from someone, I wonder who's texted me, I wonder what I'm going to feed the children for supper tonight. Oh gosh, I wonder when I'm going to go on holiday, I wonder if I've got enough money to pay all the bills. And then you're not actually focusing on what you're doing. So what I try and do is not quite meditate, but when I'm doing something, I just visualize my brain to be coated in Teflon, and it doesn't allow any other noise coming into my brain. So I'm thinking here and now of the moment, and then I'm enjoying it, because otherwise I'd be too worried about what else I've got to do or what else is going on. And so that's a really important skill that took me decades to actually realize how important it is. And it's something that I try and teach my children, because otherwise you'll get too distracted, you won't enjoy the moment, or you'll worry that you're not enjoying it because you're thinking about other things. So trying to simplify things and making the most of what you've got, even if it's actually not a great experience. Maybe you're just emptying the dishwasher and you're thinking, what a waste of time, I want to be doing other things. I try and then use that time to either listen to a podcast or actually think about things that I'm going to do next in a very ordered way. So when I've emptied the dishwasher and it's done, until the next time of course, then I know after that, then I'm going to go and I'm going to write 3 emails, or I'm going to check something on my Instagram, or I'm going to whatever I'm going to do. It's just important to have a bit of sequence in your brain, because I think as women, we're often really good at multitasking, but when our brain isn't working quite as effectively, certainly when we're perimenopausal or menopausal, we need any tools we can to try and help calm that noise in our brain. So thinking about meditation, thinking about mindfulness, thinking about living in the moment is really important as well. The other thing to think about also, we've got sleep, we've got nutrition, really important. what we drink as well. I've already said alcohol. I don't need to tell you that none of us should be smoking or vaping. The other thing that's really important is obviously our mental health. Now, mental health symptoms are really, really common in the perimenopause and menopause. And lots of people say, well, how do you know it's related to hormones? How do you know? And of course, we often don't know. And one of the ways we do know whether it's related or not is giving back the right dose and type of HRT, often with testosterone, which can also help mood. But whether we take HRT or not, many of us have times where we feel very anxious, or we feel very low, or we feel that we just have quite negative thoughts, or we have reduced self-esteem or feelings of low self-worth. And that can be episodic. It doesn't necessarily happen all the time. It could be triggered by something particularly stressful happening at work or at home, or, you know, with family or friends, or it could be a myriad of reasons. And so looking at ways to improve our mental health is really, really important. And we're all different. A lot of people find talking about it can be really helpful. Sometimes talking to family or friends, but not always. Sometimes it's useful to talk to someone external who doesn't know you. And certainly working for 20 years as a GP, often a lot of my consultations were just about listening and not being judgmental to people, but allowing them to have the space and the time to just be listened to, and knowing that sometimes the things that we're worrying about aren't going to last forever, and they're just going to affect the way we're feeling for a short period of time and how we can get over that time. Some of you might know Julia Samuel, who's done a podcast with me before. Her podcasts are absolutely amazing to listen to, and she gives a lot of really valuable advice, and she's just so experienced about how we deal with our emotions. It's important that we have emotions, of course it is, but sometimes they don't all need to bubble up to the surface at once, and also change the way we are. So if we're in a stressful situation, or we know it's going to cause stress in our bodies, acknowledge that it might affect the way your heart races or those butterflies in your stomach, but try and turn it into something very positive where you are in control, because being in control of a situation is really, really crucially important. And so making sure that if you are having any anxiety or low mood or problems affecting your mental health, that you do seek help. And some people need medication, some people might need some talking treatments, some people might just need to be reassured and know that it's okay to feel like that. Lots of us feel differently in different situations or different ways, but actually it can be worse when we bottle it up. So looking at our mental health is so important. And knowing what can affect or trigger our mental health. A lot of people tell me that they drink alcohol to numb their symptoms, but actually when they drink alcohol, those symptoms of anxiety can actually worsen as well, because alcohol can be a depressant. So not just putting sticking plaster on any sort of anxiety or low mood problems. What we eat can affect our mood as well. When we feel low, it can be really easy to have just a sweet treat. So, you know, some chocolate or something, a packet of crisps or something that might give us a quick sort of rush and feel a bit better. But in the longer term, it probably will adversely affect your mood as well. So try not to react when you're feeling low and to have something that isn't going to help in the long term, because every time if you feel low, you associate it with having some chocolate or having something that's not healthy, it will carry on, and then you'll feel worse about you doing that as well. So looking at our mental health is crucially important. Now, some of you have asked, and thanks for all your questions, about how can you do a test to see whether some of your symptoms are related to your perimenopause or menopause, or whether they're due to something else. And unfortunately, as I've said before, there's no robust test for perimenopause or menopause. Because our hormone levels fluctuate so much, you can have a normal blood test and still be experiencing symptoms. If they're low, if your estrogen and testosterone levels are low, then it doesn't mean that your symptoms are definitely due to your low hormone levels, but it's a guide that it might be. So it can be helpful but not diagnostic. So the most important thing is to talk to someone who really understands how our hormones can change and cause different symptoms. The other thing is that a lot of the symptoms that are more common in women are symptoms affecting our brains. When we do a blood test, we can see what the level of the hormone is in the bloodstream, but not in our brains or our organs, so it doesn't always equate as well. The other thing that's really important is obviously not to blame all your symptoms due to hormone levels. And in our clinic, we increasingly do more tests, blood tests, looking to see if there's other reasons for symptoms. So it can be very common, for example, to have low iron when we're perimenopausal or menopausal, might have an underactive thyroid gland, or the other thing that can often be quite low is vitamin D, especially over the winter months. So looking at iron, looking at vitamin D, also vitamin B12, folate, those can quite easily be tested. It's worth checking to make sure there's no other reason or an additional reason why you might be experiencing those symptoms. So it is worth looking holistically at everything else as well. Often we'll also do, a blood count, a kidney test, a liver test, look at cholesterol as well, and blood pressure. And so blood pressure, as I've said before, can often raise as we get older. It's just one of those things that happens. And raised blood pressure, hypertension, doesn't always cause symptoms. One of the symptoms, if it is going to cause, is often tiredness, actually. And so often we do blood pressure very routinely just to make sure that it hasn't risen at all, and just another contributing factor. The other thing to think about with how we're going to improve our future health is thinking about exercise. And it's not really so much exercise. Some people, like Dr Hussein, who I've talked to before, talks more about movement. And I quite like the word movement, because exercise means different things to different people. We're all different. And the way that we exercise, our ability to exercise, really varies. But we know that exercise or movement really will help our cardiovascular system, so our hearts and circulatory system, but also our brain and also our bones. And we know that there's an increasing incidence of cardiovascular disease, osteoporosis, dementia as we age, all these inflammatory conditions. So exercising regularly actually reduces inflammation and helps build our muscles, build our bone, it helps with our brain, really, really beneficial. And you can read different things about how much exercise we do. And there's so many different guidelines, and I think it's because no one knows, because we're all different. So some people say you have to do half an hour a day, some people say 20 minutes every other day. Actually, I don't think it really matters. I think you need to do what feels right for you. But actually, starting doing regular exercise can be the hardest thing ever. And so making it part of your routine, even diarise it, can be really important. And for people that don't do much exercise, just walking in the garden or walking outside through a park, or just catching the next bus, walking to the next bus stop and then catching the bus, or walking home rather than, getting a taxi, or just trying to do something, or going up the stairs rather than calling the escalator. And if it's too much, if you work on the 10th floor, just get off at the 9th floor and walk up to the 10th floor. Just start doing something. It can be really easy, and I know I'm really bad because I work so much. I'm sitting down, my posture's not very good, I'm on my computer, and actually I've recently got a standing desk, so I stand up quite a lot for work. And we all should take a break every hour or so, even if it's just doing some stretches, or while we boil the kettle, do some pelvic floor exercises or some squats. Trying to just keep moving is really important. And then find an exercise that works for you. It doesn't mean it's the same exercise as your best friend. Just find if it works for you and you enjoy it, you're going to more likely do it. So whether it's a class that you go out to or something you can do at home, it's so much more easier now, isn't it, to be able to do something that's online, so you don't have to physically go to a class. And I much prefer exercising at home. As many of you know, I do yoga regularly, and I like it because I can flick my mat out. I can do it any time of the day. I usually do it in the morning, and I either get up first thing, do even 15-20 minutes. Doesn't sound very much, but if I do it most mornings, that's still giving me a lot more exercise than I would do otherwise. So I get up, do some yoga, then I have a shower, and then at least I know I've done something. And then twice a week I will do a longer yoga session, so again that I know I've done it, but I sort of timetable it into my week. And then I've also started to doing some weights as well, certainly looking at my upper body. But we do know that we need to do weight bearing exercise, but actually lifting weights can be really useful and really good as well. The other thing is looking at our pelvic floor, our core is really important as well. So if you're a runner, you need, or doing exercise that doesn't involve your core quite so much, really, really important, especially with pelvic floor as well. But also it's really important thinking about our posture, thinking about our spine, because we think about osteoporosis, and osteoporosis doesn't just affect our hips or our wrists, which is where people commonly fracture. It's our spine as well. So anything that's going to support our spine, really good, really important. And it's going to get worse, I think, as we see with future generations, because they're on their phone all the time with this awful posture. So when we're sitting, really important to think about our posture and our alignment as well. So not just when we exercise, thinking about our muscles, but thinking about them at other times too is really crucially important. So those are the real building blocks that we have to really, really focus on. Other people have said, somebody asked about joint pains and muscle aches. How do we know it's related to hormones? Often we don't, but if you are getting symptoms and you're on HRT, then the dose or type of HRT might need changing, or you might need to add in testosterone. But of course we can get muscle and joint pains regardless of our hormones. We can get migraines regardless of our hormones. Some people have asked about supplements, and there are some supplements that can be useful to improve our future health, and that's very individualised. There are so many supplements we can spend small fortunes on. We have to be really careful. When we're thinking about supplements to improve menopausal symptoms, there are very few, in fact I can't think of any, that have good quality evidence behind them. So you just have to be really careful what you're taking, what the evidence is, but more importantly what the ingredients are, because sometimes you have to really look carefully and see what are the actual ingredients and what are they doing to me and what are the potential problems. A lot of people think supplements are natural, therefore they're fine, but actually they're less natural, some of them are, than even taking natural hormones, which are body identical hormones. I've seen all sorts of weird and wonderful ingredients, and there are some actually that can be hepatotoxic, so actually toxic for the liver. So we have to be crucially careful, but also really confident we know what it is we're taking. So if you are going to buy supplements for symptoms, have a really good look at the label. Speak to someone who really knows supplements to see whether it's beneficial or not. If you're looking at a supplement for your future health, then again it should be individualised. For example, I take a really good quality magnesium supplement which does show some benefit for migraines. Also fish oil can be beneficial, especially for migraines, but also for our cardiovascular and probably brain health as well. But it has to be good quality ones. Some people take probiotic as well. Everybody, whether they're adults, children, male or female, should be taking vitamin D. Ideally, certainly over the winter months, but a lot of people take it all year as well. And the recommended dose for that is 1,000 international units a day, or 10 micrograms. But some people take more, certainly if their levels are low. So taking a vitamin D supplement can be useful. Some people take folate, or they might take an iron supplement, certainly if their iron level is low as well. We do sell some supplements actually, so like magnesium and fish oil and probiotics, and an iron supplement through the clinic, but you can't order it online. You have to phone the clinic. You don't have to be a patient, you can just phone. But there are a lot, but I would be really careful when they're labelled menopause supplements, because they often contain things that are not needed. And certainly the supplements I take them to improve my health, especially looking at my migraines, but that's not because I'm menopausal. You don't need to have special supplements because you're menopausal. It's looking at, are there any supplements that might be beneficial for my future bone, heart, brain health? Or, for example, some people find taking magnesium regularly can actually help with sleep. There are different types of magnesium. Magnesium is best taken with vitamin B's because it helps the absorption. So just have a look at what you're taking, and if one magnesium doesn't work, you might want to try another one, for example. So it's very tailored. But we should be really careful what we're spending on supplements as well, because it can quite easily get out of control if you're spending a lot of money on supplements and they're not really helping. And so when you look at the evidence, it's really unclear because there aren't really good, robust clinical studies. And so we just don't know. But as some of them make sense, for example, vitamin D makes complete sense because vitamin D is very good for our bones. It's also very anti-inflammatory, and we know most of us don't get enough vitamin D, especially over the winter months. So looking at everything, but just the most important advice really I will give before I end is just be honest with yourself. Look at your priorities and look at what is going to make the biggest difference with the minimal effort as well, because it can be so easy to have all these promises that you're going to do, have these ideas, and then actually don't do them, and then you feel more of a failure yourself. So I've given you a lot of information there. I'm going to put some links to some of our resources on my stories later today. But if you do are going to try something, just try one thing and then just feel good about yourself, because life can be really hard. Most of us struggle in different ways. So just try and be kind to yourself and feel good about yourself, that you have done something that is making a difference to you, maybe not now, but certainly for your future health, because that's what it's all about. So I hope that's been useful. Next week, by popular request, I'm going to do another Instagram live about testosterone, really important female hormone that's often neglected. And so I'm going to talk about testosterone next week. But if you've got any other ideas for topics, put them in the comments when I post this on my grid. So I hope you enjoy the rest of your weekend and the week ahead. So take care, and I hope that's been helpful. Thank you.